I'm Dr. Umesh. I'm a senior consultant neurologist in TX Hospital, Hyderabad, Kachiguda. Today we are going to speak on vertigo. What is this vertigo? How it is manifested or presented to a doctor, and what we understand about this, and how do we get rid of this problem, and is there any treatment available for this, and what are the misconceptions about the vertigo. Invariably, whenever a patient comes to my clinic complaining of spinning sensation, transient spinning sensation where they lose unsteadiness, steadiness, they become completely unsteady, they lose their balance. With that, they do have palpitation, sweating, and the hands and colds becomes clammy and then cold. When they get adjusted to some place, and then after 2-3 minutes, okay, it subsides. It's a little horrifying, and then they feel very panic. What is it due to? So vertigo, there are many different varieties of a vertigo. One is called as a benign, where it is self-limiting. The other one is called a menias, where it is a long, prolonged disease. Vertigo is caused by disturbance of a water circulation in the semicircular canals into our inner middle ear. We have a small organ called as a vestibular organ, in which we have a small semicircular canals which are lesser than a pinhead. They control our balance, and whenever that circulation of a water stops there, and particular head movement causes a spinning which lasts for about less than a minute, associated with autonomic symptoms. Now what is this autonomic symptoms? They do get a palpitation, sweating, cold feet and hand. They feel that they are sinking. This lasts for about less than a minute, and then they become normal. Sometimes it occurs with the same position, sometimes it doesn't occur. So this is commonly we find this, we call it as a benign vertigo and or benign paroxysmal positional vertigo. This positional vertigo occurs commonly in hypothyroid patients, that means the thyroid disorders, or patients who've been using a neck in a particular position, especially professionals now, software professionals, surgeons, or now cell phone users. So because the neck becomes very stiff, the muscles which carry kinesthetic impulses to this organ will be lost. As a result, the neck stiffness itself will cause a vertigo. It is misnamed as a cervical vertigo. So this can be easily identified by any clinician. We don't need any specific test for this. We don't need a high gadgets like a MRI, CT, or some kind of a brainstem auditory vocal responses. It's a simple clinical detection now. When you detect it by clinical examination, you treat by simple medications. Within 1 or 2 days, with the medication it will come down. We all know that it can reoccur at any time, but it is always benign, it is self-limiting. So drink plenty of water, reduce salt, reduce sour things, and then keep doing neck exercise. Take a hot fermentation to the neck so the muscle relaxes. As a result, the vertigo comes down. So you take these precautions. It is nothing to worry about this benign. It's a self-limiting disease. If it is not controlled, then you have to see a clinician for help. Thank you.